The Nigerian healthcare system has suffered several downfalls as statistics from the World Bank shows that Nigeria accounts for 14% of all annual maternal deaths worldwide, second only to India, who stands at 17%. In spite of Nigeria's strategic position in Africa, the country is greatly underserved in the healthcare sector. Health facilities are inadequate, especially in rural areas. On this week's edition of the program, we take a look at the nation's health sector. Hello there, welcome to Dateline Abuja. I'm Gloria Umezuke. The World Bank observed that Nigeria accounts for more than 900,000 women and children who die every year from largely preventable causes. Well, similarly, the nation accounts for 13% of all global deaths of children under the age of 5 years. Again, second only to India at 21%. Well, this week's edition of the program looks at the government Saving 1 Million Lives project. But up ahead. The 2016 National Health Facility Survey by the Ministry of Health has identified inaccurate diagnosis and the lack of basic treatment drugs and equipment as a major problem in Nigeria's health sector. Let's take a listen. In 2014, the World Health Organization surveyed healthcare deliveries, and Nigeria was placed in the 197th position out of 200 countries.
You're all aware.
3 years later, the federal government is coming out with a similar report on the state of health facilities in the country, and the result is no different from the WHO report.
It's not unusual if reports like this stir up some emotional reaction initially. We should be prepared for them and need not be troubled, but rather be motivated to look inwards to reconfirm what we got right and where our efforts need to be redoubled. This field report helps us as managers and health sector players to identify weaknesses and bottlenecks to delivery of quality services, with the chance of working better to strengthen the system by providing evidence to inform administrative and operational decisions. It should also give us a baseline against which we can measure performance in good keeping with the principles of Saving 1 Million Lives program for results.
According to the report, only 41.3% of the 3,330 facilities surveyed nationwide can diagnose basic killer diseases like pneumonia, diarrhea, and malaria. The report also states that out of 30,000 primary healthcare centers in Nigeria, only 6,000 are functioning to full capacity. The Minister of Health sees the outcome of the survey as an opportunity for improvement.
The truth of the matter is that we have general suboptimal performance. I don't think we should be shy about this. On all major indicators and the quality of care indices, we are not where we ought to be. That's the truth. But we should see this as a great catalyst and a great opportunity for change, which is in keeping with the philosophy of this administration. Beyond the disbursement-linked indicators, the performance bonuses, and making this result public, I think there is an overarching objective of this exercise. And to me, there is no other one except to strengthen our health system and qualitatively improve health outcomes in Nigeria.
The 2016 Health Facility Survey is an aspect of the government's Save 1 Million Lives program targeted at improving healthcare services in Nigeria. In our interview, Dr. Ibrahim Kana, the program coordinator of the Saving 1 Million Lives program, speaks on the 2016 National Health Facility Survey and the challenges in the nation's health sector. Dr. Ibrahim Kana, you're welcome to the program.
Thank you very much.
Well, just very quickly, the last report, quite similar to the 2016 recently released survey from this organization, really can be compared in one way or the other. But tell us exactly, what are the improvements between then and now?
Well, first of all, why we conducted the National Health Facility Survey indeed is the first time that we're doing it nationally. We had conducted previous ones, and but that was sub-national. We only conducted in 13 states, but since the introduction of the Saving 1 Million Lives program for result, and since we are going to be disbursing funds to the states, we needed to assess the quality of care that the primary healthcare facilities are providing in all the states of the Federation. Therefore, we expanded the survey to be a national survey. Basically, we assessed, just like we did for the previous ones, we assessed the quality of care being provided at the facility, i.e. readiness of the human resource, the knowledge of the human resources, the equipment available, availability of drugs, financial management, administrative structure, and everything you can think of around the primary healthcare facility, including the structure of the building itself. And that's what we tried to look at in the 2016 survey, which of course is a huge improvement compared to what we had in the 2013-2014 National Health Facility Survey.
What do you define as huge?
Yeah, huge. First of all, we expanded the coverage. Now, because of the introduction of the Saving 1 Million Lives program for result, we're looking at key indicators around maternal, newborn, and child health. Therefore, here we are now specific on what does a pregnant woman require in a facility. A pregnant woman going for antenatal, what is she expected to do? What is she expected to receive? One, from the human resource in the facility. Afterwards, the investigation, that is laboratory investigations. Afterwards, drugs. Afterwards, delivery. Afterwards, the baby is born. What does the baby require immediately after birth, shortly after birth, and after discharge, even after 6 weeks? Now, we're also looking at the situation whereby in our aim towards eliminating mother-to-child transmission of HIV in Nigeria, which is one of the indicators of the Saving 1 Million Lives program for result. We also expect that a woman going for antenatal must be screened for HIV. That is one of the issues, one of the things that we also measured. And this time around, we also went further to assess the ability of the state to do what we call early infant diagnosis of HIV/AIDS. What we're trying to do is to tell ourselves objectively how many facilities, what percentage of facilities in Nigeria, one, are conducting early infant diagnosis of